Any reported outbreak of an infectious disease often instills a sense of panic amongst the public. It was not so long ago that the world was gripped by the Ebola outbreak that killed more than 10,000 people. Those who like going back into history will recall the SARS pandemic that killed over 740 people in 2003. The swine flu or H1N1 virus that claimed the lives of over 18,500 people. This can go as far back as 430 BC, when smallpox killed more than 30,000 people in the city of Athens in Greece. Now, the reported Zika virus in Brazil and the typhoid cases here at home has left people with a number of questions. How safe is my family and I from these diseases? How safe is it to shake someone's hand when greeting? Will I get the Zika virus from my neighbors who traveled to Brazil recently? Will my domestic worker from Zimbabwe bring typhoid into our home? So the questions we're asking today are, should the public be worried about these? What should people know about infectious diseases? And most importantly, how can people protect themselves from these diseases? Our expert panel is comprised of the National Institute of Communicable Diseases, the Gauteng Department of Health, a travel medicine practitioner. Now this panel will help us understand all you need to know about infectious diseases. So sit back, relax, and learn from this exciting show ahead. Be part of this show as usual by calling us with your questions or views on Johannesburg 714-6843, 6847 or 6857, or interact with us on our Facebook page, SABC Health Talk, and on Twitter at SABC Health Talk. I'm Dr. Sillo Muktaung, and this is Health Talk.
Even though people didn't know about Zika virus until now, this disease was discovered in Uganda in 1947 and was isolated from humans in Nigeria in 1968. In 2015, there was a massive outbreak in Brazil affecting more than 1 million people. Even though Brazil had fewer than 150 cases of macrocephaly in the whole of 2014, more than 4,700 cases have been reported since 22 October 2015. Of these, 404 have been confirmed and 3,670 are still being investigated. In light of this evidence, the World Health Organization declared the virus a public health emergency on the 1st of February 2016.
I am now declaring that the recent cluster of microcephaly and other neurological abnormalities reported in Latin America, following a similar cluster of French Polynesia in 2014, constitutes a public health emergency of international concern. As a precautionary measure, and because of the association, a coordinated international response is needed to improve surveillance, the detection of infections, congenital malformations, the detection of neurological complications, to intensify the control of mosquito populations, and to expedite the development of diagnostic tests and vaccines to protect people at risk.
Declaring Zika as a public health emergency of international concern singles the disease out as a serious global threat. It puts in it the same category of importance as Ebola. Unlike Ebola, where the focus was on the boots on the ground, with Zika the attention will be understanding the link with microcephaly. The World Health Organization will coordinate countries' health agencies to conduct trials to determine the risk. It will also encourage efforts to stop the mosquito that spreads the disease, as well as finding the treatment of vaccine to stop the virus. Meanwhile, South Africa appears to be gripped by another infectious disease, typhoid. Several cases of the disease have been reported across various parts of the country, including Gauteng. The disease is transmitted from one person to another through drinking contaminated water or food. Typhoid is reported to be an infectious disease that has fever-like symptoms and can damage your digestive system severely. The Western Cape Department of Health last week confirmed 3 more cases of typhoid in the province. In Gauteng province this year, there have been so far 7 reported cases of typhoid, resulting in 1/3 of a Malawian woman. Most cases in South Africa appear to have travel history from affected areas in the African continent. However, the Gauteng Department of Health says the disease has been contained.
We are positive that the situation is under control. What we need to put an emphasis on is education on hygiene. We need to make sure that we wash hands wash, food that we are preparing. And even when we are about to prepare food, let's not forget to wash hands. When we go into a bathroom, same thing. After we just wash our hands, make sure that we don't have any contamination, because this typhoid emanates from the contamination of water, contamination of food.
Statistics reveal that the laboratory services in South Africa shows that in 2015, there were 72 cases of typhoid and 103 in 2014. Typhoid is said to be a preventable and treatable condition.
All right, so what are the common types of infectious diseases and where do these occur? To help us with these questions, we're joined in our Johannesburg studio by Dr. Richard Lebete. Dr. Lebete is the Acting Deputy Director General, Clinical Services in the Gauteng Department of Health. And we're joined also on the line from Pretoria by Professor Lucille Bloembeck. Professor Bloembeck is Deputy Director, Head of Division and Head of Travel Health at the National Institute for Communicable Diseases, or simply NICD. Welcome to Health Talk, Professor Bloembeck.
Thank you very much.
All right. We've had in the news, and that's probably the reason why we're doing this show, outbreaks and, public health emergency, the Zika virus and so on. But perhaps for the sake of the public, could you perhaps just explain to us what is it that constitutes a public health emergency?
So it's an extraordinary event that requires a coordinated response and a lot more resources to bring it under control. And I think it's only the fourth time that the WHO has declared public health emergency of international concern. These are extraordinary events that have the chance of spreading internationally and usually cause a great burden on the health system. So the first one, polio has been declared one previously, Ebola, and more recently Zika. So it's not something that happens every day, but it does bring a coordinated response and a lot of effort to try and bring it under control and new research, and brings a real focus to what the problem is.
All right. Now, just coming back to the issue then of the WHO and the Zika virus. Clearly this has been in the news recently. Could you just perhaps tell us a little bit more about this Zika virus? Because we're told that this is something that originates from the African continent. Should we be worried?
So, as was mentioned in the introduction, it was identified in a rhesus monkey in the Zika forest while they were doing some investigations looking at yellow fever in monkeys. And it probably circulated in Uganda and quite a number of other countries in the region for many years, causing probably very mild illness. And it's only more recently that this concern about association with neurological problems, microcephaly, some other neurological problems, Guillain-Barré is one of them mentioned, that has changed the picture of Zika. Huge numbers of people infected, mostly mild disease, and then this concern about these clusters of babies with microcephaly, which is clearly a very severe problem to deal with.
All right. Recently, or in the recent past, the WHO was criticized for its sluggish response to the Ebola outbreak. And now in this case of the Zika virus, they haven't established conclusively, a link between microcephaly and the Zika virus, and yet, the WHO nevertheless declared, this something of a, public health emergency. Do you think that it might be a bit of an overreaction from the side of the WHO?
So that's always a difficult one. I think the link does need to be confirmed with Zika. I mean, there may be other cofactors, but this virus is spreading at an alarming rate, and the cluster of microcephaly is an extraordinary event. And yes, there does need to be a coordinated effort. There does need to be research, and I guess declaring it a public health emergency of international concern is a way of bringing the attention, the resources, the focus for all of this to be done. How this will, pan out, and will it definitely be confirmed, we will have to wait and see. But at the moment, I think it was the right thing to do. and obviously some research needs to be carried out, and it is being carried out to look at potential vaccine candidates, but importantly to confirm the link with microcephaly.
Okay. I mean, clearly, I suppose the concern or the panic amongst particularly the South African public, is whether or not this dreaded disease will make its way down to South Africa. Your comment on that?
Okay, so it is mosquito transmitted by an Aedes mosquito. We do have Aedes mosquitoes in Africa. We certainly have Aedes in South Africa, but we do not have the same subspecies that is transmitting this disease in South America and other parts of the world. So the Aedes we have are not adapted. They don't like to feed on people. They may live in plants outside, but they've not been shown to be competent vectors and able to transmit this virus. And we're hoping to look at that more carefully. So the chances of it causing an outbreak here, I think, are very low. We may well see returning travelers with Zika, but for the most part it is a mild illness, fever, headache, bit of rash sometimes, muscle pain, in only 1 out of 4 people infected. So very few people actually present with something, and they get better after about a week with no complications.
Talking about
effect on pregnant women,
yeah.
That is the concern.
Right. Well, talk about pregnant women then. I mean, there was a cautionary issued that if you're pregnant, you probably shouldn't be traveling to places like Brazil where this disease is endemic. Your comment?
I think that's good advice. Look, many people will travel and stay in air-conditioned hotels. Many of the people who are being infected are living in quite difficult conditions where there are lots and lots of mosquitoes breeding and many people infected. So, there's a large amount of virus going around. So the risks are, it's difficult to quantify them, but I think it's sage advice. I think if you're pregnant, probably not appropriate to visit countries where there's a big outbreak of Zika.
All right. Just hold on there. We'll get back to you, Prof. Bloomberg. Let me introduce another special guest we have in our studio today, Dr. Richard Lebeta, Acting DDG at Clinical Services in Gauteng Department of Health. Just welcome to Health Talk, by the way, Dr. Lebeta.
Morning, sir. Welcome.
All right. Just by the way, I mean, we're talking about the Zika virus a lot. In Gauteng, do we have an outbreak of typhoid?
In Gauteng, sir, we don't have an outbreak of typhoid. But as a matter of fact, we do have cases of typhoid in Gauteng. Now, the question is, what is defined to be an outbreak? Ireland, the World Health Organization defines it as a presence of in excess of 2 cases in the same geographical area.
Yeah. Well, we've had more than 2 cases already.
Yeah.
Yeah.
But Gauteng looks at it from a different point of view. You'll remember that we had fewer cases at the beginning.
Yeah.
But the Gauteng Department of Health has an outbreak response team. And we do know that we don't have typhoid as an endemic feature of Gauteng. But Gauteng believes in setting high standards, which means 1 case is too many. So with the presence of those three cases, the outbreak response team was set loose to look at the issue.
Okay.
Yeah.
Now, we're told that, perhaps you could just give us an update on the figures. We're told that typhoid has already claimed the life of 1 person, apparently somebody that came traveling from Malawi through Mozambique.
Yeah.
What's the latest in terms of the figures?
The figures, currently we have 13 confirmed cases. And then we have 4 suspect cases that are not yet confirmed. Now, relating to the lady who traveled from Malawi, the one who passed on, which was our first case. Now, that lady apparently traveled from Malawi to South Africa through Mozambique. She got into the country and got the symptoms, fever and the likes, and she was attended at a CHC clinic. Now, you do know that infectious diseases generally have almost the same type of symptoms. That may include malaria and the likes. And as you know, malaria is the most active one, especially for people who have traveled out of the country.
Yeah.
So being from Malawi and Mozambique, she was tested for malaria, which came out negative. But being stable, the lady was treated and discharged with strict instruction that if the symptoms do not abate, she comes back to the clinic. And indeed, the lady, after a few days, did come back to the clinic, and having noticed the non-resolution, she was then appropriately referred to a higher level of care.
Right.
Now, there some tests were made, but then she declined very quickly to a point that she landed in ICU. And when the blood tests were still being made, what happened is that she passed on.
Yeah.
And then the results came back positive for typhoid.
Okay. I want us to just hold it there because I need to just get back to Pretoria and ask Professor Bloembeck the very last question. Professor Bloembeck, let's just clear one thing. I know that you're quite busy and we pulled you out of a conference and you need to go. Thank you very much for your time. But just the one question around the transmission of Zika virus, and particularly with regards to people that have traveled to Brazil and have come back. Now, there are reported, or at least there's one reported case, whether or not this is true or not, we need some guidance from you, that the Zika virus can be transmitted sexually. How true is that?
Yes, I think there is gathering evidence to support this. I think it's probably also been happening in the areas where the outbreaks are. With lots of mosquitoes, it's quite difficult to kind of confirm which was the route of transmission. But yes, it is likely that sexual transmission can be a route for transmission. I think it's difficult to say which. The semen can be a sanctuary for a number of viruses. So I guess somebody who's contacted Zika on their travels and comes back should consider precautions to reduce those risks. But it's probably not a major issue, and I think mosquito transmission is the most important, and a returning traveller to South Africa would not pose a risk for mosquito transmission here. As I explained, our Aedes mosquitoes are not keen on feeding on people, and they're not going to transmit from somebody who's traveled. The presence of the virus in the blood is a very short one. It's just a couple of days, and so I think both of those facts together would make transmission locally very unlikely.
Okay, so just 30 seconds now. Your final message to South Africans on the Zika virus.
So I think low risk of introduction to South Africa. I think always precautions when you travel. And Richard mentioned malaria. I think you did too. That's always the big risk to protect against and to consider in returning travellers. And we await confirmation of the link with between Zika and microcephaly. But really a low risk of introduction into South Africa. And we have a number of programs being set up to monitor this.
Okay. Well, Professor Lucille Bloembeck, as always, thank you very much for your time.
Thank you very much.
All right. So after the break, we then look at different modes that infectious diseases are transmitted. Please stay with us.
Born with malformation of the limbs, David lives his life to the fullest.
I got this. Let me try my own. Got on the bed, then start playing soccer in the streets, then do this.
He can play soccer, he reads and writes, he is even able to swim, a role model to his peers.
Look at the scripture. It doesn't say I'm a conqueror, it says I'm more and a conqueror.
Join your host Buleng Molebate on Bophelong every Friday at 17:30.
Makamelo Sekhuntse, one strong woman who said no to hunger. She never allowed circumstances to pull her down. At daybreak, she is up and running in the streets of Johannesburg to make her living. After 12 hours of hard work, she goes back home being able to put food on the table. Join me, Buleng Molebate, on your show about those who take on and conquer life challenges every Saturday at 5:30.
Welcome back to Health Talk. We're talking infectious diseases, and to get more enlightened on how these diseases are transmitted, we still have with us Dr. Richard Lebete, Acting DDG in the Gauteng Department of Health, Acting DDG Clinical Services in the Gauteng Department of Health. And we're joined by another special guest, Dr. Denise Theron, who is no stranger to this show. Dr. Theron is a travel medicine practitioner based at the Carlswald Clinic in Midrand, correct?
Medicross, yes.
Medicross.
That's correct.
Welcome to Health Talk once again.
Thank you.
All right. We spent quite a lot of time talking about, Zika virus and typhoid, because these are things that are topical now that everybody's talking about. But there are other common infectious diseases that we get around. Isn't that so? Perhaps let's start with some common viral infections. Let's start with you.
Well, I think the most common is the common flu. People still get the common flu, and when they travel, they're definitely at risk of getting flu viruses as well. And every now and then we do have some other epidemic of a flu-related virus, like the avian flu in China. And these things need to be watched as well. And that's very contagious because that's by direct contact between humans.
Okay. Well, we're getting into the flu season now. At least we're going to be talking about what people can do. But you're saying even travel-related, perhaps the flu virus is perhaps the commonest virus.
Most definitely. We taught in medicine most common things occur the most commonly, so
Right.
that would be the flu.
Okay.
And yes, we do have our flu vaccines that come out from about April every year. And if you're going to be traveling especially, you need to keep up to date with those vaccines as well.
Okay. Dr. Lebete, but we don't have any flu outbreaks. Let's talk about other common types of viral outbreaks, so to say, that we've had before, or perhaps common viral infectious diseases that exist.
Yeah. Well, the most common type of viruses, as she said, is upper respiratory tract infection.
Right.
But you will know, recently in the near past, we had what is called the Ebola virus,
Right.
which was quite major and impacted on us in a very big way.
Yeah.
Yeah.
But currently, obviously we have the flu virus that it's not such a, of course, in those that, have normal immunity and so on and are okay, obviously it's a problem in those that are immune compromised. But largely it's nothing to worry about, really. But things like Ebola, obviously those are the ones that are quite serious that we need to worry about. But for now, we don't have any such in the country. Let's stay with you, Dr. Lebete. Other common infectious diseases related to contaminated food and drinks. We heard in the recent past, we had cholera, for instance. Is that still a problem in our country?
No, cholera is not much of a problem now recently. Remember, cholera is majorly waterborne. And what has happened is that specifically in Gauteng, the question of supply of water is much more improved. The local government and the government in general has taken care of some of those problems.
Right.
So in terms of infected water and the likes, we don't have much of that because the supply of water, specifically in Gauteng, is of very high standard.
Okay.
And as you know, furthermore, I mean, the water that we use in Gauteng and generally in South Africa is that of a high standard, to a point that we are able to be drinking water directly from the tap without any problems.
It's interesting you mentioned that, because recently, I think it was about a couple of days ago, there were reported cases of the quality of water in Gauteng having declined so badly that, you know, there were suspicions that there could be contaminants in the water. So basically you're saying none of that? You're reassuring us that, in fact, the quality of water is okay?
Well, the quality of water, it's basically of a high standard, as a matter of fact.
Yeah.
Now, the problems that may come up may basically be infrastructural. As we know, Gauteng is an old town. We probably may have leakages of some of the pipes and the likes, which is only a probability of infection, you know, going through the water. But basically, in terms of treatment, water treatment and the likes, we generally have water of high standards.
Okay, all right. Now, when it comes to food, I mean, typhoid, for instance, we're told that it's transmitted via contamination of, ingestion of contaminated food or water.
Yeah.
I believe that the department did some environmental inspections and so on to look for areas where there could be common sources of infection, especially around typhoid. Can you comment on that?
Yes. I think if you look at the type of typhoid that we have currently, almost all the cases are unrelated.
Yeah.
And they are from different regions. And thus far, there hasn't been any evidence of poor quality water that could have caused some sort of infection of any form.
Yeah.
So in those terms, we still a bit on the clear, because almost all the cases, save for 3, are unrelated.
Okay.
Yeah.
Dr. Theron, I mean, the issue, especially coming to travelers now, you know, people travel, and it's very common for someone traveling to say that, look, I had the worst form of diarrhea or food poisoning and so on. What are the common sources of, you know, transmission of these infectious diseases when you're traveling?
Well, of course, when we travel, we want to try all the food, don't we?
Yeah.
That's part of traveling. And eating foods that haven't been prepared properly, raw foods, going to the east and trying the sushi, maybe not the best idea. So when you do eat out, you need to make sure that the food that you eat is properly cooked and warm, hot.
Right.
You need to make sure that the fruit and vegetables are not raw, and if they are raw, that you can peel them.
Yeah.
There are standard
But what are the chances that
precautions.
if you're staying in a good quality hotel, you might get food poisoning?
Well, do remember that there's usually a buffet, and flies love food, so they might be climbing all over the food. So the best advice I usually give my patients is dish up your food, stay away from the salads, and make sure they heat it again for you in the microwave. So it's cooking hot.
Okay. You travel to places around the world, you see lots of, you know, cuisines along the streets. People prepare all sorts of lovely looking food. So you're saying that we shouldn't be trying these?
If they're cooked well and they're hot, the chances of having a problem is very, very low, so go for it. And I've also learned that the longest queue of locals is usually where the best food is to be found.
Okay. Okay. So what precautions then can there be taken to prevent typhoid and other infectious diseases? That and more after the break. Please stay with us.
SABC News, we report, contextualize and present news and current affairs honestly, fairly and fully. We consider it a duty to provide consistent, relevant, useful and top quality information and analysis. Our mission is to provide credible, accurate and interesting news programming, bringing news into everyone's homes in everyone's languages. Thank you, South Africa, for relying on SABC News for quality news output and for making us your #1 source of information. SABC News, Africa's news leader. Get all the latest news from the SABC's online news services on our website. Breaking news and in-depth coverage of everything from business, sports to politics and lifestyle. Catch the top news clips and watch live streaming of major news events on the SABC News YouTube channel whenever. Stay connected on the SABC News Facebook page and have your say on news that matters to you. And for the latest headlines and live updates from our reporters, follow us on Twitter. SABC Digital News, anytime, anywhere.
Welcome back. You may be planning to go on holiday sometime soon or much later, and probably are wondering how you can protect your health during the travel period. Well, let's understand more about prevention of infectious diseases from our two guests. We still have Dr. Darius Theron, a travel medicine practitioner, Medicross Carlswald in Midrand, Dr. Richard Lebete, Deputy DG Clinical Services, Gauteng Department of Health. Okay, let's start with you. Here's somebody planning holiday, okay? Look, Brazil, okay, currently, there's the carnival and, people are planning to go and spend a bit of exciting time in Brazil. And later on in the year, there's the Olympics. So people are planning to go to Brazil. It's a tourist attraction. What should people do? What precautions should people take?
Number one, go to your travel clinic.
Right.
Because everybody's now going to think of Zika virus and forget about yellow fever.
Yeah.
Previously, everybody thought of yellow fever, forgot about all the rest.
Right.
You also need to think of malaria. But yes, go see a professional and give enough time. The most common thing we find in travel clinics is people come and say, I'm leaving tomorrow, do a miracle.
Right.
Unfortunately, we do not have a vaccine for Zika virus. It's still in experimental phase.
Yeah.
They're hoping by the end of the year. But the main cautionary note on the Zika virus issue is if you're pregnant, do not travel.
Right.
Unless you have absolutely no choice.
Okay.
And then you need to be very careful of mosquito bites.
Okay.
Because all three of those diseases are carried by mozzies.
Okay. We'll come back to the mozzies. Just stay with the virus. Dr. Lebete, there was mention that when we had our discussion offline, that there was a measles outbreak recently, and there were talk, around lots of measles cases reported and so on, which brings the issue of vaccination. Can you reassure us in terms of the vaccine availability? Because there was talk recently that, or perhaps confusion, that there might not be enough vaccines. There was a shortage of measles vaccines and so on. What is the status now?
No, in terms of measles vaccine, I think in Gauteng we do have sufficient vaccines. Remember, the problem that always arises is in terms of the supply chain.
Right.
We have a multiplicity of clinics. And from MSD, there's lots of movement towards the affected clinics.
Right.
There may be clinics that may not be having that vaccine at the correct time. But the problem has to do with the ordering thereof from the central stores. But basically, in terms of vaccines, I think we are well covered.
Okay.
There hasn't been any complaints in as far as that is concerned.
So when anybody goes to a clinic and gets told that the vaccine isn't available, it's just a question of the supply chain issue, and the message is always go back or go to another clinic that you're told you must report to.
Yeah, remember we do have a multiplicity of clinics, especially at primary health care level.
Yeah.
And they are not very far apart. So it would be prudent, if one clinic doesn't have for the patient to be referred to the next clinic, which is usually within a walking distance. So that shouldn't be a challenge in any way.
Okay.
Yeah.
Let's get back to you, Dr. Theron, and talk mosquitoes now. You know, these things that whine all the time but are such a nuisance. But I mean, they cause dreadful diseases like malaria, dengue, and so on. Now, we're told that the mosquito that transmits the Zika virus is the same mosquito that transmits yellow fever?
And yellow fever, and dengue, chikungunya.
Okay. So where do you find these mosquitoes?
Tropical areas, mainly. In Central Africa, even here in South Africa, northern parts of South Africa, we do get these mosquitoes. They're fortunately not infected with those viruses.
Yeah.
But mainly also in South America, parts of Malaysia, those areas.
Okay. Now we're told that there's also a difference in terms of when these mosquitoes would naturally bite you. Some will bite you at night, some will bite you during the day. Your comment on that?
The malaria mosquito bites at night.
Right.
And now the problem with that one is you don't know when it bites you because it's not the one that makes the annoying noise that keeps you awake.
Okay.
The other one, the Aedes aegypti, which is the one involved now in the outbreak of the Zika virus and the yellow fever chikungunya, is the Aedes aegypti, of which, as Professor Bloomberg did say earlier, we have a slightly different strain of the same mosquito in South Africa.
Okay. So what is the best way then to protect yourself against mosquito bites?
During the day, for the day-feeding mosquito, which is the aegypti, you need to wear long-sleeved shirts, pants, loose-fitting, light-coloured. And then
why light-coloured though?
Mosquitoes don't like light colours; they go for the dark colours.
All right.
So they shouldn't be in South Africa. They've got a colour issue.
Right.
Okay. So, and on the hands, face, feet, then that is where you need to apply your DET, your peaceful sleep, all those things. If you're using suntan lotion first.
Yeah.
Repellent after that.
Okay.
And then at night, we all know about the mosquito nets.
Yeah.
So just make sure you don't lie against the mosquito net because they can come on the outside, bite through it, or that the net is ripped.
Okay. You mentioned vaccinations quickly and prophylaxis now against some of these. Can you talk malaria, yellow fever?
No vaccination against malaria. There is one in trial in Africa at the moment. I think it's in Ethiopia. They're busy with it. Yellow fever, excellent vaccine, 100% protection, but it takes 10 days to be active in the body and give you the protection. The Zika virus, there is also, they say by the end of the year there would be a vaccine, but the dengue, chikungunya, Marburg, they don't have vaccines available for those.
Right. Prophylaxis, okay, maybe before we get to prophylaxis, what other common vaccinations do you recommend for people that are traveling?
If they haven't been boosted with their measles, we usually do the measles mumps rubella booster because adults often lose their immunity over a period of time as they grow older, so you should be boosted for those. Definitely also tetanus vaccine, especially people who are going for work who might be erecting cell phone towers in Central Africa. You can cut yourself. You need to be protected every 10 years against your tetanus. And we often would give that with tetanus, polio, diphtheria, pertussis, a 4-in-1 vaccine to give you your 10-year boost on that one. Then yes, we do have vaccines against cholera. Not everybody would need that. It depends on what you're doing. We do have the typhoid vaccine, 80% protection for 3 years. So it's still not 100%. You still have to watch your food and your water precautions. And then the tablets, of course, now are very important for the malaria.
We'll come back to the tablets. Just on that point on the typhoid, Dr. Lebete, I know that the message that has been coming out of the Department of Health, Gauteng, basically has been for people to take precautions when it comes to typhoid. What are the simple things that people should do to avoid getting typhoid?
Typhoid, basically what we need to do is simple hygiene.
Right.
Simple hygiene means hand washing. And that's a basic rule.
Yeah.
Now, when do you hand wash? We know that typhoid, its route of infection, it's fecal-oral.
Yeah. What does that mean in simple terms?
What it means is that its life cycle has to do with the feces. When once it's ingested, it's an enteric bacteria.
So essentially, when you eat something that is contaminated with feces.
Well, not direct feces, but basically, I mean, when you go to the toilet, it's important to practice basic hygiene thereafter.
Yeah.
And it's very important to wash hands prior to food. You know, in the African tradition, because basically we use hand in terms of eating, it's important that before every meal, we wash our hands.
Okay.
So that's the mainstay of prevention, basically.
In my introduction, I put up a question to say, how safe is it to be shaking hands when greeting someone? Some people will say, no, instead of shaking someone's hand, because you might be getting a whole lot of contaminants in there, maybe perhaps use a fist or anything. Your comment?
Well, there's basically nothing wrong with shaking hands, because there are basically very few microbes that are infectious through touch. Most of them happen to be enteric. You have to take them in, or you need to be having a cut for you to have that infection. But then if you practice the mainstay of prevention, that with any chance of you're putting your hands into the mouth, after shaking hands and all that, before you eat, you wash your hands. After the toilet, you wash your hands. Then there's basically nothing wrong with touching. Otherwise, if we stick to that, we will be keeping distances from one another.
Okay. Let's get back to you. I said we need to just, carry on the tablets issue. Malaria, prophylaxis now. What is the best way to take these tablets, or what type of tablets are taken in the first place?
There are different kinds of tablets, and your doctor, when you go to see, will decide which tablets are the best for you. We do use the Meflium a lot these days because, as I explained, people come the day before, and that's the only tablet that you can really start the day before. There's also the tetracycline antibiotics can be started the day before, but the course is extremely long. So people tend to forget to take the tablets for the full month after coming back.
Well, this is the thing, because how should you take it? By the way, just remind us, you take it before you leave, or the first thing that I hear you saying is that it's important to consult a travel clinic. How many days before you travel?
Well, we prefer the longer the better.
All right.
Because 6 weeks gives you time to address any vaccine issues as well.
Right.
But in practice, we actually don't get that much time.
Okay.
Yeah.
All right. Okay. We'll get back just now. We need to just go for a quick commercial break. So what should you do when you suspect that you may have contracted an infectious disease? That and more after the break. Please stay with us.
AKA went overseas to win 2 awards for himself for Best South African Male Artist and a second one for his hit track All Eyes on Me. The Lamb film is nominated for Best Foreign category at the 2016 Oscars.
We couldn't find finance until the script won a very prestigious prize in France.
Dr. Pascal has inspired many in song and theatre presentation.
And in 1985, when I came, I went to the SABC on the radio, and I was the voice of Africa.
Catch Trends every Friday at 9 p.m.
Welcome back. Now, before we carry on, I believe we have a caller on the line, Rose from Amhlanga. Good morning, Rose, and welcome to Health Talk.
Morning, Doctor. How are you?
Good, how are you? Your comment, the question, please.
No, it's a question, Doctor.
Yes.
Doc.
Yeah.
Yes. Yeah, I'm having a partner who's diabetic.
You're having a what?
Yes. A partner who's diabetic.
Yeah, okay.
Yeah. So now we used to kiss each other. So I just want to find out, this kissing, is any infectious, or is it not like that? Am I going to take that diabetic too, or what?
All right. Well, thank you for the question. There's two things here. At least if I can translate. A traveler who's diabetic. Okay, diabetes on its own has its issues around immunity, and then there's issues around kissing. Kissing, I would imagine, as in, is it a recognizable form of transmission of these infectious diseases? Your comment?
Some of them, yes. Others, no. Malaria you can't get through kissing. You can get flu through kissing. So the question is more about, is there a concern around this person traveling somewhere, bringing something back, or is this just a general question? Straightforward kissing, even for typhoid, if I'm correct, please correct me if I'm wrong, is not an issue. It's more the contact with the stool or the excrement of the person that gets into either the water supply and then into the digestive system, then kissing somebody, saliva exchange.
Do you want to comment?
Yeah, I think she has it right. Remember, there are diseases that are infectious.
Yeah.
Some are infectious and contagious.
Yeah.
Now, if we talk contagious, we mean just by touch. And more often than not, kissing, it's a dry sort of kiss. In those type of kisses, you are not likely to be infected. But if you exchange, body fluids in kissing, then that's when it becomes a problem.
Okay. All right. Well, talk infectious diseases. Perhaps before we come to what to do, let's just come back to that issue of malaria tablets after having come back home now.
Yes.
Because it's always an issue to remember to take the tablet, because there's no motivation. I mean, you've enjoyed your holiday, you now have no money, now you must remember to take these dreaded tablets. What's the best way to remember to take these tablets, and what should motivate you?
Maybe the best thing is to download an app on your phone to remind you. That's how I do everything these days.
Right.
Look, if you're doing the Malinol, it's a shorter course, only a week after, it's one a day.
Yeah.
If you're doing Meflium, it's one a week, it's 4 weeks after.
Right.
Doxycycline, the antibiotic, is one a day, 4 weeks after getting back.
Right.
So it does depend on what you're taking. But you need to be very cautious about it, because you can actually get malaria if you don't finish your course.
Okay.
So it does increase your chance of getting ill.
All right. Some of these infectious diseases are self-limiting. I mean, just a few symptoms there and there, and I suppose even if you do nothing, you're going to be fine. But some require urgent action. Let's talk about common symptoms of infectious diseases. Any one of you can comment.
Well, everything starts like the flu. That's the biggest problem in medicine.
Yeah.
Everything starts with the flu, fever, muscle aches, joint pains.
Right.
And those are the first few symptoms of every single infectious disease, I think.
Yeah.
Quite
So the
typical.
important thing is then, when you experience those symptoms, having come back from a period of travel, what should you do? Dr. Lebet?
Yeah. You see, in medicine, I think the mainstay of treatment and prevention, it's being alert.
Yeah.
And more specifically, when you have traveled, it's important to be able to tell that to your doctor. That must be the first thing to tell your doctor, so that you increase the index of suspicion. And with that index of suspicion, if you've told your doctor that, then it becomes easier for the doctor to start thinking of the line of thought that the doctor must follow.
Talk about index of suspicion. Should doctors have a high index of suspicion for typhoid in Gauteng?
Like I said, originally, before these cases, it was not necessary because it was not endemic.
Yeah.
Now that we've had another, an upsurge in the number of cases, it's obvious now that the index of suspicion must increase.
A little bit higher.
Because the problem with the lower index of suspicion is that you are likely to miss out. And that's because most of the infectious diseases start with similar type of symptoms. Fever, general body malaise, chills, and the likes.
And very quickly, typhoid, is it treatable or untreatable? Do you need to quarantine people that are hospitalized or not?
It is treatable. It's best to hospitalize, as in this case, because usually what happens with if you are doing tests, they are not almost immediately available.
Yeah.
So you need to admit these patients, and while you are running the tests, only after you have proven it can you release them.
Okay.
But that's when you have a high index of suspicion.
Yeah.
Because the other problem is that, the original signs and symptoms of malaria and typhoid are almost the same.
Right.
So it's important that you admit at that stage, but only with a high index of suspicion.
And perhaps on the side of the patient?
Well, coming from a private clinic, it's very difficult practically. You can't go testing every single patient. So you need to be aware of what the danger symptoms are, so that you can pick that up and then look.
Okay.
Yes.
All right. Well, unfortunately, we've run out of time. Dr. Richard Leberte, Acting DDG, Clinical Services, Gauteng Department of Health. Dr. Danis Taran, Occupational Medical Travel Medicine Practitioner, Carlswald Clinic in Midrand. Thank you so much for your time.
Thank you.
Well, folks, that's all we have for you today, I'm afraid. Join us again next week on SABC News. A reminder, please share your views and comments via our Facebook page, SABC Health Talk, and follow us on Twitter at SABC Health Talk. Remember that you can watch repeat of this show at 2 p.m. today and on Tuesday morning at 5 a.m. or simply just go to the SABC YouTube link to get all our previous shows. I'm Dr. Salome Daoud. Thank you for watching, and please do take care.